I'm Dr. Michael Harrison, and what I'm about to share with you today could genuinely save your life. In my 40 years of treating patients, I've seen far too many people suffer strokes that could have been prevented. And here's what troubles me most. Some of these strokes were caused by foods that my patients thought were healthy, foods their doctors recommended, foods they were eating every single day believing they were doing something good for their bodies. Now I know that might sound alarming. After all, we've been told our entire lives that fruit is healthy. Eat more fruit, they say. 5 servings a day, the more the better. And for most people, most of the time that's absolutely true. But here's what I learned after 4 decades of medicine, and it's something I wish I had understood earlier in my career. Context matters. Your individual health profile matters. And for adults over 50, especially those with certain conditions or taking certain medications, some fruits can actually work against you in ways that dramatically increase your stroke risk. Today, I'm going to walk you through 5 fruits that may be putting you at risk, and I want to be very clear about something from the start. I'm not telling you to never eat these fruits again. That would be overly simplistic, and frankly, it would be bad medical advice. What I am going to do is give you the information you need to make informed decisions. I'm going to explain the science behind why these fruits become problematic under certain circumstances. And then, because I believe in empowerment over fear, I'm going to share 3 fruits that research suggests may actually protect your brain against stroke. Before we dive in, I want to be clear. While I'm a physician sharing evidence-based information, this video is for educational purposes only. It's not a substitute for personalized medical advice from your own doctor, who knows your specific health history. Always consult with your healthcare provider before making any changes to your health regimen. That said, let's get into it. We're going to count down from number 5 to number 1, and I've structured it this way deliberately. The fruit at number 1 is the one that shocked me the most when I first understood its mechanism. It's a fruit that's marketed specifically for heart health, and yet for a significant portion of adults over 50, it may be doing the exact opposite of what they think. Stay with me until the end, because that final revelation could change how you think about so-called superfoods forever. Before I explain the science behind these fruits, let me share a story that perfectly illustrates what I'm talking about. I want to tell you about someone I'll call Margaret. Now, Margaret is like many of the patients I see, 67 years old, retired school teacher, devoted grandmother. She came to see me because she'd been having these strange episodes, brief moments where her vision would blur, or her words would come out jumbled. They'd pass within a few minutes, and she'd brush them off as senior moments. Nothing to worry about, she told herself. Margaret told me something I'll never forget. She said, "Dr. Harrison, I do everything right. I quit smoking 20 years ago. I walk 3 miles every day. I eat fruit with every meal because my doctor told me it would help my blood pressure." She was genuinely confused and frightened. How could someone who was doing everything right be having these symptoms? What Margaret didn't know, and what her previous doctor had never explained, was that some of those fruits she was religiously eating were interacting with her blood pressure medication in ways that were actually increasing her stroke risk. Her case opened my eyes to a pattern I started seeing over and over again in patients over 50. I'll come back to Margaret's story in a moment, because what we discovered together transformed her health. But first, let me walk you through these 5 fruits, starting with number 5. Number 5 on our list is the banana. Now, I can already hear some of you saying, "Dr. Harrison, bananas, the most basic, most recommended fruit in the world?" Yes, and let me explain why, because this is crucial. Bananas are extraordinarily high in potassium. One medium banana contains about 422 milligrams of potassium. For most people, that's a good thing. Potassium helps regulate blood pressure, supports muscle function, and plays a vital role in heart health. But here's where it gets complicated. If you're over 50 and have any degree of kidney dysfunction, and research from the National Kidney Foundation suggests that as many as 1 in 3 adults over 60 have some level of reduced kidney function, often without knowing it, your body may not be able to efficiently clear excess potassium. This leads to a condition called hyperkalemia, or high blood potassium. A study published in the American Journal of Kidney Diseases found that hyperkalemia is associated with significantly increased risk of cardiac events and stroke. The mechanism is straightforward but serious. High potassium levels can cause irregular heart rhythms, including atrial fibrillation. And atrial fibrillation is the single largest risk factor for a type of stroke called embolic stroke, where a blood clot forms in the heart and travels to the brain. Now, here's where Margaret's story comes back in. When we ran her blood work, we discovered her kidney function was at about 65%, which is common for her age and wouldn't normally be flagged as a serious problem. But she was eating 2 to 3 bananas every day, plus taking a potassium-sparing blood pressure medication. Her potassium levels were consistently elevated, creating electrical instability in her heart that was causing those brief episodes she'd been experiencing, what we call transient ischemic attacks or mini-strokes. We didn't tell Margaret to eliminate bananas entirely. That would have been unnecessarily restrictive. Instead, we worked with her cardiologist to switch her medication and reduced her banana intake to 2 or 3 per week rather than per day. Within 6 weeks, her episodes stopped completely, her potassium normalized, and 3 years later, she hasn't had a single TIA. The practical recommendation here is simple. If you're over 50, ask your doctor to check your kidney function and potassium levels. If either is even borderline, have a conversation about how many bananas and other high potassium foods are appropriate for your individual situation. For most people, a banana a few times a week is perfectly fine, but 3 a day, every day, in the context of reduced kidney function, that's a different equation entirely. Moving to number 4 on our list, and this one might surprise you even more. We're talking about grapes, and specifically, I'm going to focus on a hidden danger that most people are completely unaware of. This reminds me of a patient I'll call Robert. Robert was 72, a retired engineer who prided himself on his logical approach to health. When he read that grapes contained resveratrol, a compound associated with longevity and cardiovascular health, he went all in. He was eating grapes throughout the day, every day, sometimes consuming over 2 cups of grapes daily. Robert came to me after his primary care physician noticed his blood glucose had spiked significantly over 6 months. Here's the thing about grapes that gets overlooked. They have one of the highest glycemic loads of any fruit. A single cup of grapes contains about 15 grams of sugar, and because they're small and easy to eat mindlessly, most people vastly underestimate how many they consume. Research published in the journal Stroke found that adults with elevated blood glucose levels, even those not diagnosed with diabetes, have a significantly higher risk of both ischemic and hemorrhagic stroke. The mechanism involves damage to the endothelial cells that line your blood vessels. Chronic blood sugar spikes create inflammation, accelerate atherosclerosis, and make your blood vessels more prone to both blockage and rupture. Robert's fasting glucose had risen from a healthy 92 to a concerning 118. He was on 118. The doorstep of prediabetes, and his stroke risk had climbed accordingly. When we looked at his diet, the single biggest contributor was his grape consumption. Over 500 calories a day just from grapes, most of it sugar. Robert told me something I'll never forget. He said, "I thought I was being so smart, eating all that resveratrol." He felt betrayed by the health marketing, and honestly I understood his frustration. The studies on resveratrol that made headlines used concentrated supplements, not dietary grapes. To get the amount of resveratrol used in those studies, you'd have to eat an amount of grapes that would flood your system with sugar. We replaced most of Robert's grape consumption with lower glycemic berries, and within 4 months, his fasting glucose returned to normal range. The practical takeaway here is moderation. Half a cup of grapes is a reasonable serving, especially if you're watching your blood sugar or have any metabolic concerns. But treating grapes as a health food to consume without limits, that's a trap I've seen too many patients fall into. Now let's move to number 3, and I want you to pay close attention here because this one affects a massive number of people. We're talking about oranges, and the problem isn't the orange itself, it's what oranges do in the context of medication. I had a patient named Susan who came to me absolutely terrified. She'd woken up one morning with numbness down her entire left side. She spent 3 days in the hospital after what turned out to be an ischemic stroke. She was only 61, and she was one of the healthiest living people I knew. Susan's story initially baffled her medical team. Her cholesterol was perfect, her blood pressure was controlled with medication, she exercised regularly, didn't smoke, barely drank. By all conventional metrics, she was low risk. But when we dug into her daily routine, we found something crucial. Susan drank fresh squeezed orange juice every morning, about 16 ounces. Now, orange juice in that quantity contains compounds called furanocoumarins. These compounds inhibit an enzyme in your gut and liver called CYP3A4, which is responsible for metabolizing many common medications. Here's the critical piece. Susan was taking a statin for mild cholesterol management and a calcium channel blocker for blood pressure. Research from the Journal of Clinical Pharmacology has documented that citrus juices, including orange juice in large quantities, can increase the blood levels of certain medications by as much as 50 to 200%. For Susan, her blood pressure medication was being amplified to dangerous levels. Her blood pressure was dropping too low during certain parts of the day, creating unstable blood flow to her brain. This kind of hypotensive episode, when severe, can actually trigger a stroke by reducing blood flow to vulnerable brain regions. Now, I want to pause here and remind you that I'm not suggesting you change any medications without speaking to your prescribing physician. What I'm sharing today may inform a conversation with your doctor, but any changes should only be made under their guidance. For Susan, the solution wasn't complicated once we identified the problem. We adjusted her medication timing and reduced her orange juice to a small glass, about 4 ounces, rather than 16. Her blood pressure stabilized, and in the 3 years since, she's had no further events. The practical recommendation is this. If you take any medication regularly, especially statins, blood pressure medications, or blood thinners, have a specific conversation with your pharmacist or doctor about citrus juice interactions. The amount matters enormously. A whole orange or a small glass of juice is very different from 16 ounces of fresh squeezed. Number 2 on our list is going to be familiar to many of you who take medications, but I want to explain the mechanism more thoroughly than you may have heard before. We're talking about grapefruit. Now, many of you already know that grapefruit interacts with medications. Your pharmacist may have mentioned it. There might even be a sticker on your prescription bottle. But here's what concerns me. Most people dramatically underestimate how serious this interaction can be, and many don't realize the effect can last for up to 3 days after consuming grapefruit. This is exactly what happened with a patient I'll call James. James was 74 and had been on blood pressure medication for 12 years with excellent results. He decided to improve his diet after his wife was diagnosed with early dementia, wanting to stay healthy so he could care for her. He started having half a grapefruit every morning, thinking it would support his cardiovascular health. 6 weeks later, James had a hemorrhagic stroke, a bleed in his brain. He survived, thank God, but the recovery was long and difficult. The investigation revealed that his blood pressure medication, a calcium channel blocker, had been amplified to 3 times its intended potency by the daily grapefruit. His blood pressure had been dropping to dangerously low levels, and one of these hypotensive episodes caused a vessel in his brain to rupture. The science here is clear and well documented. Grapefruit contains high concentrations of those furanocoumarins I mentioned earlier, even more than oranges. These compounds irreversibly inhibit CYP3A4 enzymes. Your body has to create new enzymes to recover, which takes 1 to 3 days. So even if you eat grapefruit only once, the effect persists. A comprehensive review in the Canadian Medical Association Journal identified over 85 medications that have serious interactions with grapefruit, including many common blood pressure medications, statins, anti-anxiety medications, and blood thinners. For people taking these medications, the effects can include severely elevated or lowered drug levels, unpredictable blood pressure swings, and significantly increased stroke risk. James told me something that haunts me. He said, "I saw that warning on the bottle, but I thought it was like most warnings, overly cautious." He almost lost his ability to care for his wife because he underestimated a food-drug interaction. My practical recommendation is direct. If you take any regular medication, treat grapefruit as off-limits, unless your doctor and pharmacist have specifically confirmed it's safe with your exact medication and dosage. This isn't excessive caution. This is informed risk management. Now we arrive at number 1, and I saved this for last because it genuinely shocked me when I first understood the mechanism. This is the fruit that troubled me most because it's aggressively marketed as a heart-healthy superfood. We're talking about pomegranate. I know, pomegranate. The fruit whose juice is sold with heart images on the bottle. The fruit that magazine articles tout as protecting your arteries. How could pomegranate be number 1 on a list of stroke risk fruits? Let me tell you about David. David was 69, a retired physician actually, a colleague of mine. He'd read all the research on pomegranate's antioxidant properties and its potential benefits for arterial health, so he made pomegranate juice a daily ritual, 8 ounces every morning, sometimes more. What David didn't fully appreciate, even as a physician, was that pomegranate juice has even more powerful enzyme-inhibiting effects than grapefruit. A study published in the Journal of Clinical Pharmacology found that pomegranate juice inhibits both CYP3A4 and CYP2C9 enzymes, affecting an even broader range of medications. David was on warfarin, a blood thinner prescribed after a heart valve replacement. The pomegranate was interfering with his warfarin metabolism in unpredictable ways. Some weeks his blood would be too thin, raising his hemorrhage risk. Other weeks the interaction would cause his levels to spike, putting him at risk for clots. His INR, the measure of blood thinning effectiveness, was erratic despite careful medication management. This is where most people get it wrong. They assume that if grapefruit is problematic, they can just switch to pomegranate. But research from the American Heart Association has shown that pomegranate's enzyme interactions are comparable to, and in some cases stronger than, grapefruit. It affects many of the same medications, including statins, calcium channel blockers, and critically, blood thinners like warfarin. But here's the part that troubled me most about pomegranate. Even for people not on these medications, pomegranate in large amounts can significantly lower blood pressure. For someone with already well-controlled blood pressure, this additional lowering effect can create hypotensive episodes, which, as we discussed, are themselves a stroke risk factor. David's wake-up call came when he stood up too quickly one morning, felt severely lightheaded, and fell, striking his head. Given his blood-thinning medication and erratic INR, we were terrified of a brain bleed. Fortunately, he was okay, but it was a warning we both took seriously. Here's what David told me afterward, and this is coming from a retired physician. He said, "I knew about the grapefruit interaction. I had no idea pomegranate was in the same category, maybe worse. I assumed because it was marketed as heart healthy, it would be safe for someone with heart issues. That assumption almost cost me dearly." The practical guidance here is crucial. If you take blood thinners, statins, blood pressure medications, or drugs for heart rhythm issues, treat pomegranate with the same caution you would grapefruit. Don't assume that superfood marketing means safe for your specific situation, and even if you don't take these medications, be mindful of pomegranate's blood pressure lowering effects, especially if you're already prone to lightheadedness or low blood pressure. Alright, stay with me here. We've covered some serious territory, and I want to make sure I leave you with hope, not just warnings, because the truth is, while some fruits require caution under certain circumstances, other fruits may genuinely protect your brain against stroke. Let me share 3 fruits that the research suggests can be powerful allies in stroke prevention. Protective fruit number 1 is the blueberry, and I want to tell you why I recommend blueberries to almost every patient I see. Blueberries are rich in compounds called anthocyanins, the pigments that give them their deep blue color. Research from Harvard's Nurses' Health Study, one of the largest and longest-running studies of women's health, found that women who ate the highest amounts of anthocyanins, primarily from blueberries and strawberries, had a 32% reduction in heart attack risk. Subsequent research published in the American Journal of Clinical Nutrition found similar protective effects against stroke. The mechanism is elegant. Anthocyanins help improve endothelial function, meaning they support the health and flexibility of your blood vessel walls. They reduce inflammation, lower blood pressure modestly and safely, and may help prevent the oxidation of LDL cholesterol that contributes to arterial plaque. Here's the beautiful part. Unlike the fruits we discussed earlier, blueberries have minimal effect on the CYP enzymes that metabolize medications. They're low in sugar compared to grapes. They don't have the potassium load of bananas. For adults over 50, blueberries are about as close to a universally beneficial fruit as exists. My practical recommendation is half a cup of blueberries daily. Fresh or frozen, both retain the beneficial compounds. Add them to oatmeal, yogurt, or simply eat them as a snack. This is one case where the health marketing matches the science. Protective fruit number 2 is the avocado. Now I know some people debate whether avocado is a fruit, but botanically it is, and I include it here because its benefits for stroke prevention are remarkable. Avocados are rich in monounsaturated fats, the same heart-healthy fats found in olive oil. A large study published in the Journal of the American Heart Association followed over 68,000 women and 41,000 men for 30 years. They found that people who ate at least 2 servings of avocado per week had a 21% lower risk of coronary heart disease and a significantly reduced risk of stroke. The mechanisms are multiple. Avocados help improve cholesterol profiles, raising HDL and lowering LDL. They contain potassium, but in a matrix of fiber and healthy fats that moderates its absorption, making it safer than isolated potassium sources for most people. They're anti-inflammatory and have been shown to improve blood vessel function. Perhaps most importantly for adults over 50, avocados support the absorption of fat-soluble vitamins, many of which play roles in brain and cardiovascular health, and they have virtually no impact on blood sugar. Half an avocado most days of the week is what I recommend to my patients. It's satisfying, nutrient-dense, and one of nature's best tools for cardiovascular protection. Protective fruit number 3 is the strawberry, and the research here is compelling. Strawberries, like blueberries, are rich in anthocyanins and other flavonoids, but they also contain significant amounts of a compound called fisetin, which has been shown in laboratory studies to support healthy aging of blood vessels. A meta-analysis published in the journal Nutrients found that regular strawberry consumption was associated with improved blood pressure, reduced LDL cholesterol, and decreased inflammatory markers. What I particularly appreciate about strawberries is their accessibility and versatility. They're available year-round, they're affordable, and they can be incorporated into countless meals. They're also relatively low in sugar compared to many fruits and have a gentle effect on blood glucose, 1 cup of strawberries several times per week is an easy, evidence-based addition to a stroke prevention diet. Let me bring this all together for you, because this next part is where the rubber meets the road. First, know your medications. If you take any regular medications, especially blood pressure drugs, statins, blood thinners, or heart rhythm medications, you need to have a specific conversation with your pharmacist about food interactions. This isn't optional, this is essential. Bring a list of the fruits and juices you consume regularly. Ask specifically about citrus, grapefruit, and pomegranate. Second, know your numbers. Ask your doctor about your kidney function, your potassium levels, and your fasting blood glucose. These numbers should inform how you approach high potassium and high sugar fruits. Normal kidney function at your age? Bananas are probably fine in moderation. Reduced kidney function? You need to be more careful. Third, emphasize the protective fruits. Blueberries, avocados, and strawberries have strong evidence for stroke prevention and minimal risks for most people. Making these staples of your diet is one of the simplest, most effective things you can do for your brain health. And remember, this information is meant to educate and empower you, not replace the advice of your personal physician. Take what you've learned today and have a conversation with your doctor about what's right for you. If you found this helpful, if you learned something today that you can use, I'd really appreciate it if you hit that subscribe button. I release new videos every week specifically designed to help you take control of your health and maintain your independence as you get older. And I promise to always give you the science without the hype. Drop a comment below and tell me which of these fruits surprised you most. I personally read every comment, and I'd love to hear from you. And if you know someone who takes blood pressure medication or blood thinners, please share this video with them. You might be giving them information that could prevent a stroke. Before I let you go, I want to share one final thought. The reason I make these videos is because I believe you deserve to understand your health in a way that actually makes sense. For 40 years, I watched patients struggle with information overload, conflicting advice, and fear. I saw too many strokes that could have been prevented with simple knowledge. My mission now is to give you that knowledge, not to scare you, not to sell you anything, just to help you make informed decisions that keep you independent, active, and healthy for as long as possible. The patients I told you about today, Margaret, Robert, Susan, James, David, they all made changes based on understanding their individual situations. They didn't panic. They didn't eliminate entire food groups. They simply took the information, talked to their doctors, and made informed adjustments. Every single one of them is doing well today. That's what I want for you. Not fear, but wisdom. Not restriction, but informed choice. Not dependence on anyone, but empowerment to advocate for your own health. Take care of yourself. I'm rooting for you, and I'll see you in the next video.